Hi, my name is Megan Myers. I'm a genetic counselor at the University of California, San Francisco. I work with hereditary cancers, and I also help support and run a website called Kintalk.org, which is a family communication and educational website about hereditary cancers, specifically for Lynch syndrome and hereditary breast and ovarian cancer. Today, I'm actually going to be discussing Lynch syndrome and just really going over what Lynch syndrome is and how you can learn if you have Lynch syndrome and the things you can do to help prevent or reduce your risks of cancers associated with Lynch syndrome. Well, Lynch syndrome is one of the most commonly inherited colon and endometrial or uterine cancer conditions. It's estimated that about 1 in 270 to 1 in 500 people in the United States actually have Lynch syndrome. Individuals with Lynch syndrome have upwards of about an 80% lifetime chance to develop a colon cancer and about a 60% chance in their lifetime to develop an endometrial or uterine cancer. Other cancers that we see with Lynch syndrome include stomach, ovarian, hepatobiliary tract, small bowel, brain, urinary tumors, as well as sebaceous carcinomas, which are cancers of the skin. Lynch syndrome is a hereditary condition that's caused by a genetic change that we call a mutation. Well, what do we mean by a genetic change or a gene? Well, first of all, a gene is a hereditary unit of DNA that occupies a specific location on a chromosome inside a cell. Genes carry directions to cells and tell them how to make specific proteins to perform and regulate all bodily functions. So, for example, genes tell our body what color eyes we're going to have. Genes are also capable of helping our body to create the right types of proteins to fight and prevent cancer. So genes are able to actually replicate themselves every time that a cell divides. So every time that a cell grows and divides, these genes are copied and put into the new cells. So a mutation is a change in a gene, as sometimes we call it a spelling mistake. And what happens is when there's this change in the gene, we see that the gene is not able to function properly, usually, and it actually can cause diseases, including cancer. Genetic mutations can be inherited from a parent, or they can happen randomly as cells are growing and dividing. In the case of Lynch syndrome, a person actually inherits the genetic mutation from a family member. The 4 genes that are involved with Lynch syndrome are called the mismatch repair genes. Everybody is born with these genes, and we actually need these genes as they help to fix these mistakes that occur when cells are growing, dividing, and copying the genes in the DNA from one cell to another. The mismatch repair genes see when there are these mistakes or mutations that happen, and they actually can fix and repair them. When one of these mismatch repair genes is not working correctly, they cannot fix the mistakes that are happening inside the cells when they're being copied, and therefore they cannot stop these mistakes from occurring, and these mistakes can continue to grow and divide inside of our body. The names of these mismatch repair genes are the MLH1, MSH2, MSH6, and PMS2 genes. And more recently, there is another gene that is not part of the mismatch repair machinery, but it was found to actually be associated with Lynch syndrome as well. It's called the EpCAM gene. These 5 genes, when they have mutations in them, they cannot work correctly to help our body to fix the mistakes that occur as our cells grow and divide. So when someone inherits a mutation in one of these genes, it means that their body is not able to properly repair DNA. Put simply, there is a mistake in the gene that normally helps prevent cancer, which is why Lynch syndrome is associated with a higher risk for some cancers. Well, the first way to figure out if your family has Lynch syndrome is actually looking at your family history. Lynch syndrome is very characteristic for many generations in your family to be affected with cancer, and specific types of cancer, the cancer that I listed before. So colon and endometrial cancer being the most common, as well as stomach, small bowel, pancreas, hepatobiliary tract, brain, urothelial cancers, and cancers of the skin as well. These cancers are often diagnosed at younger ages than the average population. So for example, anyone diagnosed with colon cancer under the age of 40 is someone who should be evaluated for Lynch syndrome. Additionally, if there are family members who have been diagnosed with more than one cancer in their lifetime, that's another indication that there might be Lynch syndrome in your family. Not all families have this typical presentation. So not all families have multiple generations affected with cancer, or they might not have every family member diagnosed at young ages. Some people might be diagnosed at older ages as well. We know, for example, with the PMS2 gene, sometimes there may only be 1 or 2 colon cancers in a family that's very, very large. So if you're concerned about your family having Lynch syndrome or hereditary cancer condition, the next step is really to go and speak with a genetic counselor or talk with your doctor about getting a referral to speak with a genetic specialist. You really want to talk to somebody who knows about specific hereditary cancer conditions and who specializes in them so that they can do a good job of assessing your family and deciding whether or not your family needs specific testing to see if you or your family members carry a specific genetic mutation. When you go and meet with a genetic counselor, of course, the first thing they're going to want to do is take a family history. So it's always good to speak with your family members and gather information about their personal histories, their medical histories, and of course, any cancer history within the family. Once the genetic counselor has taken your family tree, or they actually draw a pedigree, which is the family tree, they will look back and look for certain patterns in the family that might be suggestive of hereditary cancer condition, such as Lynch syndrome. The types of testing that can be offered are tumor testing as well as genetic testing. Cancers associated with Lynch syndrome express special types of features that are characteristic of the Lynch syndrome. There are specific studies that can be done to look to see if your tumor or the cancer has these special features. And the types of tumor testing that can be done are called microsatellite instability and immunohistochemistry. So what your genetic counselor or genetic specialist would want to do is request the actual tissue from the surgery or the biopsy of the cancer and send it to pathology to look for these special features using microsatellite instability and immunohistochemistry. Sometimes tumor testing isn't necessary or can't be done because there is no tumor block to be requested. And sometimes instead of doing a tumor test, a genetic counselor will recommend doing genetic testing first. Now, tumor testing is just one step in diagnosing someone with Lynch syndrome. Once the tumor testing is done, depending upon the results, the genetic counselor or your genetic specialist will recommend further steps or additional testing, such as genetic testing. Genetic testing is when you or the family member who is affected with cancer provides a DNA sample, which is in the form of either a blood sample or a saliva sample. That sample is then sent to a specific genetic laboratory to look at these mismatch repair genes. So to look at the MLH1, MSH2, MSH6, PMS2, and UPCAM genes to see if they can find any mutations or mistakes in these genes that would explain why you developed your cancer or why your family member developed the cancer. There are 3 different types of results that you can receive from a genetic test. You can receive a positive test result, which means that a genetic mutation or a mistake in one of your mismatch repair genes was found, and you do indeed have Lynch syndrome. This would be a diagnosis of Lynch syndrome. If your genetic test results are negative, that means that no genetic mutation was found in your mismatch repair genes. Unfortunately, genetic testing isn't perfect, and we know that some individuals who have Lynch syndrome still receive negative genetic test results. Another reason that that test result could be negative is that the person who had the genetic test doesn't have Lynch syndrome, but might actually have another hereditary cancer syndrome that we did not test for because it was not caused by one of the mismatch repair genes. Another interpretation of a negative test result means that you don't have Lynch syndrome and you may not have a hereditary cancer syndrome at all. It may mean that your cancer was due to a sporadic or random event, but not due to something that was inherited from a family member. And lastly, another type of test result that you can get from genetic testing is called a variant of uncertain significance. A variant of uncertain significance is when there is a change found in one of your mismatch repair genes, but we don't know what this change means. We don't know if it is what we call a deleterious change or a mutation in the gene that's causing the gene not to work correctly, which would cause Lynch syndrome, or if it's a benign change in the gene, meaning there is a change in the gene, but it's not impacting how it works. When somebody has a variant of uncertain significance, we can't say whether or not they have Lynch syndrome. And we have to go back to their family history, and we have to counsel them based on their family history in terms of what type of screening and recommendations we can give to them and to that person and their family members based on what their family history really looks like. Now, these variants of uncertain significance are often reclassified later on once more research is gathered, and they can either be classified as deleterious, and we find out that that change actually did cause Lynch syndrome or does cause Lynch syndrome, or it can be classified to benign, and we find out that that change does not impact the function of the mismatch repair genes. So if you do test positive for Lynch syndrome, what can you do? Well, now you know that you're at these increased risk for these different types of cancers. And so the first step that we would recommend is to take the steps that are most comfortable for you to reduce your risk for cancers, and specifically colon and endometrial cancer, since those are the 2 cancers that have the highest risk. We recommend that individuals with Lynch syndrome undergo colon cancer screening. So somewhere between 20 and 25, an individual with Lynch syndrome will want to start having annual colonoscopy. If colon cancer was diagnosed earlier than the age of 20 in a family with Lynch syndrome, then we recommend colon cancer screening 5 years before the earliest cancer diagnosed in the family. In terms of endometrial and ovarian cancer screening, some doctors recommend having a transvaginal ultrasound done. Another technique to screen for endometrial cancer would be an endometrial biopsy, where samples of the endometrial tissue are taken at random to look for endometrial cancer. And to screen for ovarian cancer, sometimes clinicians will do a blood test looking for specific markers of ovarian cancer called a CA125. Now, there's been some controversy recently about whether or not endometrial and ovarian cancer screening is very effective. So you would need to talk to your doctor about endometrial and ovarian cancer screening and decide if it's the right type of screening for you. Some families with Lynch syndrome will have strong family histories of other types of cancers, such as stomach cancer, pancreas cancer, and so on. With those types of families, your gastroenterologist or your primary doctor will set up a specific screening program for you for those cancers. Other types of preventative measures that you can take to reduce your risk of Lynch syndrome cancers include chemoprevention. Aspirin has been studied for many, many years. In a recent clinical trial called the CAP2 trial, we found that if an individual with Lynch syndrome takes aspirin for 2 years and they take a minimum of 600 milligrams a day, that they can actually reduce their risk of colorectal cancers as well as other Lynch syndrome associated cancers by up to 60%. The protective effects of aspirin were not evident in this study until about 5 years after beginning the aspirin therapy. And there are more studies that are actually being done right now with the CAP3 trial to figure out how much aspirin a person should take, as well as how long they really need to take it to achieve all of the benefits from the aspirin. That clinical trial won't be done for a number of years, and once it is, we will be able to provide more specific advice on taking aspirin. Another recent article came out saying that ibuprofen may have very similar protective and beneficial effects as aspirin. Both aspirin and ibuprofen have side effects. So before you decide to take aspirin or ibuprofen, you need to speak with your gastroenterologist about these side effects and see if you really are a good candidate for taking these. Another chemoprevention type therapy would be oral contraceptives for endometrial and ovarian cancer. We found that oral contraceptives can reduce the risk of endometrial and ovarian cancer in women. Again, that's something you want to discuss further with your gynecologist or your GYN oncologist to find out whether or not taking oral contraceptives would benefit you. Now, let's talk about risk-reducing surgeries. So, for women who have an increased risk for endometrial and ovarian cancer with Lynch syndrome, we actually recommend that once a woman has completed her childbearing, we recommend that a woman has both her uterus and her ovaries removed once she's done having children in order to completely remove or eliminate the risk for endometrial cancer and greatly reduce her risk for ovarian cancer. And so there is a slight risk still for developing a ovarian-like cancer even after your ovaries are removed, but the risk is very marginal. So there are many different ways that you can reduce your risk of Lynch syndrome-associated cancers. And you have to decide with your clinician what is the best way for you. Now, a very important topic that is near and dear to my heart is sharing this information with family members. If you yourself were diagnosed with Lynch syndrome, that means that you inherited Lynch syndrome from either your mother or father. And that means that your siblings are at risk to have Lynch syndrome, as well as your children, nieces and nephews, aunts and uncles, grandparents, and so on. Someone who has Lynch syndrome has a 50% chance of actually passing on their specific genetic mutation to their children. And their siblings also have a 50% chance of having Lynch syndrome themselves. Sharing your genetic information, sharing your test results are the biggest gift that you can give to them. By sharing this information, they are able to then go to their doctors and find out if they have Lynch syndrome as well by having a genetic test. You can share this information by sending the results in the mail, sending it through email, or you can also do it through kintalk.org, which is the website that I run, where we help families communicate this information, as well as helping other family members educate themselves on what Lynch syndrome is. It's hard sometimes to explain what Lynch syndrome is. It's such a complex condition. And so having a website where you can send a family member there so that they can learn about the condition is really important. So again, education and communication about what is going on in the family is very, very important, because these cancers can be prevented with Lynch syndrome, especially colon cancer. Now, as I mentioned, children have up to a 50% chance to inherit Lynch syndrome from the affected mom or dad. Now, we recommend that genetic testing for Lynch syndrome be done at the age of 18. The reason that we recommend that is because there's no screening that we would recommend before the person is 18 years of age. Additionally, it's important for the individual who's undergoing genetic testing to understand what they're undergoing testing for, how that's going to impact their life, and if that's something that they really want to know about. If you do not have children and you are thinking of having children and you'd like to have biological children who 100% for sure do not have Lynch syndrome, one thing that you could consider is something called pre-implantation genetic diagnosis, or PGD. That is where embryos are screened to see if they carry the specific genetic mutation that is causing Lynch syndrome in your family. It's a much more complex than how I just described it, and it would be something that you would want to actually talk to your gynecologist about, or a reproductive specialist team. Lastly, I just quickly want to answer a few questions from some of our viewers. And so someone from Calgary, Alberta, Canada writes, "My grandfather died of colorectal cancer, as did my father. There were 5 sibs in the family, and while 2 are alive, of the remaining 3 who died, 2 died of colorectal cancer and 1 of esophageal. Is this supportive of Lynch syndrome? And if so, what should I do and my sibs do for screening and prevention? I'm 59 years old and my siblings are younger. Should we undergo genetic testing?" Well, I agree that your family history is suggestive for Lynch syndrome or some sort of hereditary cancer condition. I would recommend that the first step is that you actually meet with a genetic counselor so that they can take a more detailed family history and decide what the next step for you would be. So as I had discussed earlier, the 2 types of testing would be tumor testing and genetic testing. Most likely the genetic counselor would want to do one of these 2 tests to see if Lynch syndrome is running in your family. If for some reason you don't want to undergo genetic testing, you do want to have more frequent colonoscopy just based on your family history, and that's something you can talk with your gastroenterologist about. If you did test positive for Lynch syndrome, we would recommend that your family undergo colonoscopy every year, as well as potentially taking aspirin or ibuprofen, and for women, oral contraceptives. And then, of course, for preventing endometrial cancer and ovarian cancer, possible risk-reducing surgeries. And so good luck with you to that, and I hope you do reach out to a genetic specialist in your area. If you need help finding one, please visit kintalk.org and write this question. You can post it, and I'll be happy to help find someone in your area for you. Now, someone else from the Los Angeles area says, "I was diagnosed with ovarian cancer at age 45. My mother passed away from pancreas cancer. I have read that pancreatic and ovarian cancers may have a Lynch syndrome connection, but my oncologist does not think I need to get tested. I was tested for the BRCA mutations and tested negative. What are your thoughts? Well, you are correct that ovarian cancer and pancreas cancer fall within the Lynch syndrome spectrum. They are also associated, as your doctor said, with the BRCA genes, or the hereditary breast and ovarian cancer syndrome. I think it is important for you to continue to have this ongoing conversation with your doctor, and you can even bring in this webinar cast if you'd like, and show to them it is something that they should consider doing genetic testing for you for Lynch syndrome or possibly other hereditary cancer conditions. Genetic testing is growing leaps and bounds every month, and we're now offering panel testing, which is where instead of just looking for Lynch syndrome or just testing for the 4 or 5 Lynch syndrome genes, we can test for 20, 30 cancer-specific genes that cause hereditary cancer conditions. And so that might be a discussion that you would want to have with your oncologist. But you are correct, these 2 cancers are associated with Lynch syndrome and should be further evaluated by your oncologist or your genetic counselor. And lastly, someone in Georgia writes, I'm getting conflicting opinions about how often I need to get a colonoscopy after my recent Lynch syndrome diagnosis. I have papillary serous uterine cancer already, and that was aggressively treated 5 years ago. Well, as I mentioned earlier, anyone with Lynch syndrome should be getting colonoscopy annually. Some clinicians will say every 1 to 2 years, but you really don't want to stretch it past those 2 years. We recommend in my clinic annual colonoscopy. And so I hope that you're able to get that colonoscopy soon. All right. Well, if you have any questions, please feel free to post them, and I'm happy to answer anything else. And again, thank you so much for allowing me this opportunity to speak about Lynch syndrome. Thank you.